We actually need a program like Bridges to Health to really help young people, children that are in both our child welfare system and our juvenile justice system that really have unmet health needs. And usually children in both of those systems really have very significant health needs that have not been addressed. Children grow up in the context of a family. And so in order to address the needs of that child, we really need to make sure that we're building capacity in families, their ability to support that child or young person. That's very important. So the B2H is a Medicaid waiver that we got from the federal government. And so this helps us bundle these services together, pay it through Medicaid, and really provide the supports that families need to be able to take care of their children. It is a wonderful program, the first in the country, so I'm very proud that New York did it, in collaboration with our partners. You know, the Department of Health was wonderful in working with us to do this. If a family's having trouble getting a child into the appropriate educational program, we help them to pay for educational advocates to help them negotiate the systems for respite care. So it really does help to access those services that are really not available in a comprehensive way through any other health program. We've actually had children adopted. We've actually had children brought from out of state, adopted. We've had children that are medically fragile. We've been able to move them from institutions, from hospitals, into homes with supportive services. And we've cut the length of stay of children in foster care who've been able to return either home or to, a lower level of care, which is always our goal. So we've seen results already. It's another resource. And so many of the caseworkers will really recognize the fact that sometimes, they're scrambling to find the services in the community and trying to find ways to access and pay for them because, they're not available. And so hopefully through today's program, they're going to be able to understand how they can access the service. We'll be able to understand the different services that they can access through B2H, who qualifies, but how really, truly important the program is for services for their children and families that they're working with. So this is another tool for them, and we want them to use it.
Hello, my name is Joan Meyer. The Bridges to Health Home and Community-Based Waiver Program, also known as B2H, is designed to support children in their homes and communities. In this video, we're going to explore the details of the Bridges to Health program. The video features an introduction and the following 6 chapters. In Chapter 1, we'll look at eligibility criteria. Chapter 2 covers benefits to the child and family. In Chapter 3, we'll look at benefits to and the role of the case planning agency. Chapter 4, what are the services and how are they integrated, is divided into 6 parts. In Part 1, we'll look at healthcare integration. Chapter 4, Part 2 looks at crisis avoidance, management and training, immediate crisis response, intensive in-home supports and services, crisis respite, and planned respite. Chapter 4, Part 3 looks at family caregiver supports and services and skill building. Chapter 4, Part 4, special needs community advocacy and support. In Chapter 4, Part 5, we'll look at pre-vocational services, supported employment, and day habilitation. And in Chapter 4, Part 6, we'll see adaptive and assistive equipment and accessibility modifications. Chapter 5 of this video looks at the referral process, and in Chapter 6, we'll look at the role of ACS, local departments of social services, and DJ Joy.